Great, thanks. Hi, everybody. Welcome to, first of all, happy Transgender Day of Visibility. And welcome to the Transgender Healthcare Roundtable, co-sponsored by CLAGS, the Center for LGBTQ Studies here at the CUNY Graduate Center, and the CUNY LGBTQIA+ Consortium, and NYU Langone Health. My name is Matt Brim. I'm going to do a very quick introduction of me, and then I'm going to ask our four other speakers to quickly introduce themselves. What we're going to do today is tell you a little bit about a survey that we've tried to put together, and we're going to ask for your help revising it. And then we're going to have an open discussion. The first part of that open discussion, after we talk about the survey for a minute, is student-centered. And so what we want to do, the survey was of students' needs and barriers to accessing healthcare, mostly for transgender students, but with applicability to LGBTQ students as well. And so we're going to have an open discussion that's student-centered first, and then we're going to ask if anybody in the audience is representing a healthcare center from one of the CUNY campuses. And we're going to try to assess what the healthcare centers need. Not every campus has one, but where there are healthcare centers, what their needs are and what they think are barriers to treating transgender students and LGBTQ students. So my name is Matt Brim, and I am the Executive Director of CLAGS, the Center for LGBTQ Studies. And I just want to welcome everybody here in person in the Skylight Room and also online. CLAGS is committed to free and accessible LGBTQ studies for everyone. And so we are happy to welcome you into the space of the nation's largest urban public university. CLAGS is proud to be here. And we're especially proud today to support our transgender students, staff, and faculty. Allie, do you want to introduce yourself next?
Sure. I don't know if I need a microphone, but I'll use it. My name is Allie Brashears. I am a professor at LaGuardia Community College and the director of the CUNY LGBTQIA+ Consortium. And I want to welcome again all the people who showed up here in person. Thank you. And all the people online. Thank you as well. And I'll turn it over to Elie Al Kazzi.
What? Hi, everyone. Yes, my name is Elie Al Kazzi. I'm one of the gastroenterologists at NYU Langone. I spend most of my time in Chelsea. That's where my clinic is, but on NYU. And yeah, I'm very happy to be here. Thanks for everyone being here in person and online. And what else? Oh, that's it. Yes.
We're joined by two panelists on Zoom today, Jason Domogauer and Merlin McDonald. Jason, will you introduce yourself? And then Merlin, will you introduce yourself, please?
Sure. Hi, everyone. Sorry, I'm not there in person. My name is Jason Domogauer. My pronouns are he, him. I am a radiation oncologist at NYU. I also serve several other roles. I'm the director of diversity, equity, and inclusion for my department, radiation oncology, assistant director for community outreach and engagement for the Perlmutter Cancer Center, which is the cancer center of NYU, as well as the director of LGBTQ+ cancer care and research programming at the Cancer Center. So I do a lot of work with prevention, screening, all the way from diagnosis to supportive care and survivorship care. So really focus in on making cancer screening more accessible to individuals that are LGBTQ+ identifying, and making sure that we all get affirming, tailored care that we all deserve. So really grateful for being here, and sorry, not there in person.
Hi, my name is Merlin McDonald, and I am the current health intern with CLAGS, and also a former undergraduate student at Brook College.
Once more, welcome everybody. On the screen, you can see our ASL interpreters. Thank you so much for being here today. And also behind the scenes is Hannah Salzer, our communications fellow. Thanks for all your help, Hannah. So hi Shelley, Dr. Shelley Eversley, Professor of English, Black and Latinx Studies at Brook College. Good to see you. So it is always the right time to think about transgender healthcare at CUNY. And we had been thinking about it for a while, and then we found ourselves in the current moment where healthcare for trans people and gender non-binary people is much less stable, much more in question, especially for those under 19. And so we find ourselves in a moment where we're trying to respond in a way with information and information sharing and resource sharing. And one of the ways that we're trying to be part of that conversation is together we designed a survey to try to assess LGBTQ, but especially transgender students' healthcare needs within the CUNY system. CUNY is very large, it's 25 campuses, and it's sometimes hard to see the big picture and to see what's happening. And so we're just trying to get a sense of students' needs and, as I said, barriers to accessing healthcare. Merlin distributed and sort of shaped up the survey for us. Merlin, you want to point to the two items that you found most interesting?
Yeah. So one of the main things that I found interesting about the results from the survey was that 63% of people who responded didn't use campus health services, and we only are measuring within the most recent academic year. And then those who did only use the services 1 to 3 times within the most recent year. And then the second thing that I found interesting was when we were looking at the barriers or like the perceived barriers to accessing services, the 4 most common selections were lack of or limited promotions of health services offered, lack of or limited insurance coverage, fear of discrimination or stigma, and lack of specific services, and specifically notated hormone replacement therapy.
Thank you very much, Merlin. And I just want to say Merlin did a lot of work designing this survey. It was fantastic. And I should have said my pronouns earlier. They're she, her. I'm so used to Zoom. I'm used to them being on a screen in front of me. So just as a little bit more background to what Matt was saying, the CUNY system is, like he said, enormous, 25 campuses, is 250,000 students. And it is a little like the federal state system where each campus is both independent and also under the governance of CUNY, but it's a real mishmash of how those systems actually interface. And so there's not as much centralized information, especially around the health of the students and how they're accessing these resources. And one of the things that, just to get some traction on this problem, we wanted to do was put together this survey and then meet with people to better understand what's actually happening on the ground. Because you might look at CUNY and think like, obviously there's like some centralized data warehouse for all of this information. There is not. And it's very difficult to get like real traction on these issues, especially around healthcare and especially around LGBTQIA+ healthcare.
And the only 2 things I really kind of want to add is, I mean, why we're doing this. That's something we kind of discussed is, and especially during this administration, during these horrible times we're going through, it's very important to kind of remind everyone that we are here and we are able to have the space and to have this conversation mainly because of the sacrifices and the bravery of 2 transgender women back in Stonewall during the 1969. It's so we all, every single other letter than the T and within the LGBTQIA+ spectrum, I think we should be very grateful to those 2 transgender women. 1 and 2. Anytime we want to talk about health equity or just care for just healthcare for all, it's only just and it's only equitable when we are able to take care of the most marginalized in our community. And over and over and over, transgender people have had the worst medical outcomes. Adding the intersectionality of of gender, of race, of everything else, it ends up being that transgender women of color got it worse. So whenever we are able to provide, we as in medicine and healthcare and public health, we are able to provide the just care for the most marginalized and the most affected or sub-community of our community, that's when we can barely even dare to say that, oh, we have good healthcare and a just healthcare for all. So that's kind of why we wanted to do this. And with the fact that we know nothing about what's needed and where we at, we thought that having the survey would just at least be kind of a needs assessment for us, trying to figure out at least where to start. I mean, I know we're not going to be able to fix everything, but at least we're here and we're starting the conversation.
Of trans people having poor health outcomes is true, but let's break that down a little bit because that's a very scary thing to say during a scary time. So the reason the trans people have higher rates of negative health outcomes is something called the allostatic load. And the allostatic load is a measurement that we use in public health to assess future health outcomes based upon the wear and tear on the body. And that wear and tear is from stress. So every time you experience stress, whether it be from transphobia, from racism, because you're poor, because you're in traffic, your body has to go up and then down, and then up and then down. And the more social determinants of health that we have, such as being a queer person, a trans person, a person of color, a poor person, all these sorts of things, can serve to elevate our allostatic load. And the higher your allostatic load, the more we can predict what your future health outcomes in terms of cardiovascular disease, higher rates of cancer, diabetes, stress-related things. However, one thing really important to remember is that it is very possible to bring down that allostatic load. And the way you do that is through relaxation, is through taking those deep breaths, helping your body physiologically come back down. And so that way, all trans people don't have to have these negative health outcomes. We can actually change that by taking more power within our emotional health, which is really hard because we live in this difficult world. I just wanted to add that, but thank you, doctor.
JD and Merlin, if you just need to speak up because we can't see you that well, so we can't see if you're raising your hand. So just unmute yourselves anytime you need to. So the problem that we are confronting is that there's not enough information known about how transgender people are served within the CUNY health care system. And that's medical health care, and that's mental health care, and that's wellness. And so we're trying to find out. And so we need help to do that because the system is so big. Hannah, if you could drop the link to the survey in the chat for those online. Everybody here should have gotten a copy of the survey that we distributed, and there's one on the table if you didn't get one. Merlin pointed to a question that we want to actually start with to try to open the discussion up, and that is the barriers that students found when trying to access trans students and LGBT students confronted when they're trying to get access within the CUNY system. Just to repeat what Merlin said, the number one answer was a lack of or limited promotions of services offered. So it's an information problem. Lack of or limited insurance coverage, and that's a socioeconomic class problem. Fear of discrimination or stigma, and that's a broad social problem. And then lack of specific services such as hormone replacement therapy was one that was mentioned. So maybe we can have an open discussion now for the students in the room, or if you're student facing in your work at CUNY, and you can sort of contribute to our responses of the survey. What have you seen in terms of the barriers that students might face when trying to access healthcare? Or we can open it up beyond that. Just what information do you have to share with us about how LGBTQ healthcare is working or could work better at your CUNY campus? There's a second question because we have two NYU Langone doctors here, and that is how can the CUNY system both provide services within the system and connect students to services outside the system. So these are our broad questions that we're trying to get at. If you raise your hand, I'll bring around a microphone.
Basically, we want you to solve our problem.
Thank you. I'll introduce myself. My name is and my pronouns are he and him, and I am at the School of Public Health, and I am in the Masters of Public Health in Community Health program, and as long as everything goes to plan, just about done. And for the past last semester and this semester, I have been doing my my community collaborative, which is field work with CUNY Cares. CUNY Cares is a pilot program out of Healthy CUNY. Healthy CUNY is a program that actually serves a lot of these needs for all CUNY students. And through a grant, they were able to do in 2022 a basic needs assessment of CUNY students in the Bronx specifically. And they did stratify for LGBTQ plus students. They found very similar results. That was a lack of knowledge of knowing what's there, how do I get it, when do I get it, and then also a hesitation, a kind of it's not always easy to ask for help, right? And so with that said, there's a lot of data that actually already exists. I think they surveyed about 15,000 students in total. They were online surveys, so it was self-reported. They did do some qualitative research with about 26 students, I think. So there's some research, but that's 2022. So that's a very different perspective than where we are right now, especially for trans students. So I really suggest that y'all, I'm happy to connect because I've been working with them for the past year. I just designed, so what as a part of my cohort from my community collaborative, our job has been to find and organize and tailor specific resources based upon the 4 essential unmet needs they found, which were access to healthcare, access to stable housing, access to mental health care, and access to food access, stable food access. And so for 3 specific student populations based upon the interest or we focused on LGBTQ plus students, working students, and students that are parents. And I currently have 4 guides that I finished less than 12 hours, well, something like that, 12 hours ago, of resources within the Bronx for students. And so right now they're being reviewed by the rest of the CUNY Cares team for further editing. However, that's their solution right now. So using grad students to how I'm suggesting to them, I have a lot of experience. I was a health comms for social change major. So I have a lot of, I've been designing them for that reason. So I have suggestions in terms of how communications need to happen so that people can actually understand, like they can find the information because it's a lot. But that's one suggestion that maybe I'll hook up with CUNY Cares because Dr. Nick Freudenberg and Patty Lamberson, who's the assistant or the deputy director of the program, I've been working with them. So I think they'd be really interested in that, just connecting that information. Yeah, I think that's what I had to share.
That was super helpful. Please connect us.
By the way, does the School of Public Health have a health center? A wellness center, uh-huh.
Is it mostly focused on mental health or, yeah? Who else wants to go? I'm doing the Ricky Lake thing here.
Hi, everyone. Christina Chawla. You can call me either Christina or Chawla. I use she, her, they, them pronouns. I'm the University Student Engagement Programs Manager for the CUNY Office of Student Inclusion Initiatives. My primary area of focus is LGBTQI LGBTQI plus programs and initiatives CUNY-wide. That's me. Things on my mind are, like has been brought up, empowerment, disempowerment of students. I shared with students this past week about a policy their campus asked them to do something that I said was outside of policy. And they said, well, we're just passing the word along, even though I've put in writing multiple times that they don't have to comply. They still feel like they have to, they don't feel like they can say they can't, which I understand. I wish they didn't feel that way though. I guess I wanted to highlight or bring up what I learned from our PSC union, faculty staff union, that represents some faculty and staff. I remember there was a push to educate the community more about the high ratio of mental health counselors to students. It was like astronomically outside of recommended practice, that CUNY does not actually have a manageable caseload ratio for mental health counselors across the system to students. And this is years and years of data. I Googled real quick because I couldn't remember, and it's like 2020 data that I could find. So I don't even know how much it's changed since the pandemic, but I wanted to bring that up, that like people are trying to organize to push CUNY to provide services that, as people who are trying to organize, we know CUNY isn't providing those services. And I've worked with some counselors who are so swamped and they care so much about their students and they don't know how to, it's just a ridiculous sort of wave of need and not enough resources for them to provide support for their students.
May I ask how much do you are able to kind of outsource to the government of New York City? Like H&H, for example, or the Medicaid offices and things like that?
A lot of colleges have a practice of you can come in for free and we refer you out for regular counseling. That is common practice across, to my knowledge, universities. And even with that practice, CUNY mental health counseling service offices are inundated with a need for more support, even with that referral system. Yeah. Sorry, but one more thing I want to put out there in terms of like access. And I'm interested in, my background is education and student leadership development, but as a human, having learned a little bit about health outcomes being rooted in community and relationships and combating isolation. That's a theme that has been important for my own wellness. And I wonder how much that's rooted in the work we're trying to talk about today and push for frameworks that don't sort of, particularly body positivity and elevating like how your relationships are with people matters more than how much you weigh. Those kinds of destigmatizing being fabulous and fat. And also I wanted to put into the space migrant status is another factor for our queer and trans community.
Anybody else? Even if it's just helpful if you just share what campus you're at and how whether you've interacted with healthcare services or what you've experienced in terms of like healthcare provision.
Hi, my name is Zachary Capel, and I'm a student at Kingsborough. I'm also the president of our school's LGBT Student Alliance. I'm very unfamiliar with the services that we have on campus. Kingsborough has historically had an issue with getting information to students about anything at all. And the little that I've heard from my peers about the counseling services is that they're very incompetent and just completely unhelpful. And then during times of crisis, this actually led them to stop going to school for a while. One thing that I personally do in the club is I have like a cork board and I put up flyers and different pamphlets of resources that I've collected from the city. And I also personally make phone calls and emails for other students. And for this, like students come to me, they have trust in me. So I'm able to, point them in the direction of things in the city or outside of campus. And this has worked, and I have had students come to me and tell me that I have helped them. I believe that if we had staff that is specifically trained to do that, that would be significantly better, especially if they have specific trainings about how to deal with the specific demographic that Kingsborough has, because it is very diverse. And it is unlike other schools where it's adults coming back to school predominantly instead of students coming from high school. So yeah, that's just my 2 cents. I think even if there isn't anything on campus directly, there should still be some sort of, I don't know if it would be a center or designated staff that can take that load, because it is hard to be a student and do that for other students.
Can you say your name one more time, your first name? I missed it.
I'm Zachary.
Zachary. So you noted, as others have, that sometimes campuses have LGBTQ resource centers, right? Which are separate from LGBTQ healthcare centers or just student health centers. I'm curious, the panel has been thinking about this question. What is the relationship between LGBTQ resource centers, which do a lot of programming on campus, and, if they have them, the health centers on campus? Does anyone see the connection if your campus has both? Do the LGBTQ resource centers point students in that direction? Do the centers work together?
We're just sharing, so you don't have to have a thesis, but
The SPH, we just got an LGBTQ resource center, but it's like a part of the student wellness. And the student wellness folks push to make it, but it's really just like a corner with like pride stuff, but like also resources. But you wouldn't walk in and think, because in my undergrad, for instance, we had a specified room that was an LGBTQ, so you could walk in and know that's what this is. When you walk into there, you're like, oh, cool, pride flag. And you know it's a wellness center, but not that that's and so there's a distinctiveness in the visual accessibility of it.
I'll just say I'm at LaGuardia, and at LaGuardia it's very separate. We have the Women's Center, which also houses the LGBTQ programming and is tied to the Safe Zone. And then we have a wellness center that's focused on mental health. And then we have the actual like health center that's focused on taking your blood pressure and blood glucose. And I think there's very little interaction between all of them. So I don't know if that's mirrored at other campuses.
Merlin, one of our panelists, just graduated from Baruch. And so Merlin, I wonder if you can you give us what's happening on the ground at Baruch in terms of LGBTQ healthcare?
Yeah, I wasn't super active in the LGBTQ center, but it was more like a club. And it was like in a room. And I remember they had a sign on it because it was in the club suite, but also the health center was there as well. But they were both like separate. And I just remember that the LGBTQ center was very removed. And then also they ended up removing all signage because they had issues with vandalism. So they just kind of put it as far away from the other clubs and made sure that you couldn't really tell at all unless like you knew from someone else. So that's the only way that I was able to like even really learn about it. And then the health center, I went in there a few times, but it was just somebody at a desk. And I only went in there for different like hygiene items, and they didn't have any. And so that was kind of the extent of my experience.
Thank you.
Hey y'all, this is Chala again. I worked at Baruch, and years ago they had an LGBTQ center that was staffed, that someone higher up, I think her title was dean or assistant dean, pushed to open. And it was staffed part-time. Someone had a 30-hour job to support veterans, LGBTQ plus students, and the wellness services at Baruch. And when that dean left, they said that that center no longer existed. I think it became the club room. but that is different to have a staffed LGBTQ plus center versus a space for a student club to use. To our knowledge, on the CUNY-wide LGBTQI Council, we are aware of 9 of the 25 CUNYs that have an LGBTQ plus center that has some kind of staffing. If we add CLAGS as a research space, that would be 10 CUNYs with an LGBTQ plus space with a staff person. That could be a faculty member, or it could be a research foundation or a HEO. These are different kinds of paid titles. So that's in stark contrast to the idea that wellness centers partner maybe with an LGBTQ center. Most CUNYs don't have an LGBTQ plus center. 3 did open this year. So a year ago, there were 6 CUNYs with an LGBTQ plus center. Now there's 9. LaGuardia, the hub, the Safe Zone hub, is in the Women's Center. There was one more thing. Oh, and a lot of members of the CUNY-wide LGBTQI Council are volunteers, and there's at least 2 representatives at every campus, and a lot of them come out of mental health counseling, like they are counselors on campus, or I used to work at Medgrover's College, and one of our campus representatives was the person who coordinated the wellness center. So there is a pattern of overlap, Venn diagram of like resources are being prompted out of wellness spaces or mental health services, being like, we need to have a specific space or resources for LGBTQI plus folks. I see that intersection, but it varies campus to campus.
So it sounds like we're identifying a problem where it would work better if there were multiple layers of support that could reference each other and talk to each other. And so we're thinking about LGBTQ resource centers, one layer, health centers, another layer, wellness centers, sometimes those are the same, another layer. But some of the barriers we've heard are stigma, so there's no signage. So how does a student see the space and feel welcome into the space to be served? Economics sounds like a huge barrier, so that CUNY doesn't have the money, prefers to put the money somewhere else. Thinks it's not a service that is a service to be provided to students. And that's unusual. Much of higher ed has health centers on campuses. A very distressing fact is that CUNY actually considers Medicaid to be student health care. That is their first line of health care, and that's a stated position, not just the default position. They actually do expect students to use Medicaid as the first line of medical care.
It just occurred to me, like most campuses that I'm familiar with, the health center provides pretty minimal healthcare resources. Like the one, and the staff at LaGuardia are fantastic. I'm not, giving them any grief about this, just limited resources, but it's, blood pressure testing, glucose testing, like real, if you need this, it's very minimal, support, and some, I think, STD testing support for that, with a lot of liaison to like NYU will come in and do HIV testing or something with the healthcare center, or sometimes with the LGBT, the safe zone, but even those are not well coordinated. And so I think there's like this paucity of actual healthcare on the CUNY campuses is what I'm hearing. And then there's a real, it's also a paucity of information about how to get access to that. Like when I ask my students, like where they go, they're all just like, I go to Colin Lord, but that's not the only resource in town. And that's also an understaffed, overworked.
I do have a comment on that, and then maybe put Jason can answer a little bit more as director of, has a couple of kind of positions. But the thing about NYU and Medicaid is that unfortunately on a system level, not a provider level, on a whole system level, NYU does not accept Medicaid as an insurance for primary care services, but it is open for all subspecialties. And that at that point, it becomes a provider level. Meaning, for example, in gastroenterology, which is, poop and stuff, anything from the mouth to the anus. I am one of the few providers who accepts Medicaid. That's something that's not going to change. And I actively, so you have to opt out of it. And a lot of, unfortunately, for money reasons, they do. But that's the issue. So I see a lot of Canon Lord patients after a referral has been placed, and I see them, and I'm happy to do that. But that is one of the system level barriers that is there.
Can you give like an example of what within the NYU system, what does Medicaid cover? What does it like? So if I go to general practice, that's not covered, but if I go to a specialist?
Yeah. So if you want to see a primary care physician, just the person who takes care of all of your medical problems, a little bit of everything, that is not going to be possible for Medicaid or Health First or things that are Medicaid based. But if you do have a primary care doctor outside of NYU who tells you, I would like you to see an endocrinologist, like a hormone or diabetes problem doctor, or kidney doctor, or a heart doctor, or a gastro doctor, you are able to find providers within the NYU system to do that. OBGYN is a little bit different because a lot of patients consider, especially young patients consider OBGYN to be their primary, but we do have OBGYN outside of Manhattan for a reason I do not really know, that do accept Medicaid to see kind of patients on a more primary care level.
Last follow-up question is do you, and you might not know this, but like, do you know how much this is mirrored at other large systems like Montefiore or Mount Sinai?
No, I don't have any idea, unfortunately. But all is not lost, and there is hope, and there are people in our system who are really working to bridge that gap and trying to kind of, and we call them care coordinator or care navigators. And I think that would be my segue to Jason to tell us more about that and how we can help, on a more of a, sorry, Jason, before you go in, I had a comment.
So I wanted to share that actually at all three campuses in the Bronx, so Hostos, Lehman, and Bronx College, they do offer, their health center offers general services such as wellness visits, physicals, immunization, STI testing, insurance assistance, and referrals. However, those are during business hours, and that's not available to everyone. And NYC Health and Hospitals has Pride Centers, and their Pride Centers are specific times when doctors who have an interest in working with LGBTQ plus patients and maybe a little bit more training, for instance, giving like a transmasculine person a pap smear. You wouldn't want a regular gynecologist without awareness to do that. And so at NYC Health and Hospitals, if you do not have insurance and you do not qualify for insurance, they will give you everything for free. They will give you all of your surgeries, all of your medications for free from their hospital pharmacy. And so, or if you have any other medical, you need like an appendectomy, you can get that too for free, regardless of your immigration status as well. If you qualify for insurance, they will help you get that insurance. And if there's a procedure or medication that you need and there is a gap, they will work with you to fill that gap.
Yes, thank you. H&H is an amazing kind of a ally or someone we work with. A lot of us, at least in Bellevue, which is the flagship hospital, a lot of us from NYU, we either cover both hospital or we work very closely. Personally, I don't work at Bellevue, but I work very, very closely with a lot of the providers there, and we share patients, and we are able to send each other kind of notes in a secure way, obviously, like to share the care of our patients. I've had patients at one point lose their coverage, and then they'll have to go to H&H. So there is a very strong continuity of care that we provide in between both hospitals. Jordan? You had something to say? No? All right, Jason, to you.
Yeah. That was actually a great leeway with Bellevue. So one of the, towards what Ellie was saying about care coordinators, is one of the great people, part of my team is a care coordinator, Alex Trivanoff. And the aspect of Alex's job is to connect patients or connect persons that may not have providers, either primary care providers or specialty care providers, to individuals who've, for lack of better terms, been vetted to be affirming, either knowledgeable or queer identified themselves, but able to provide resources and care that is tailored and welcoming. And the reason for that is a lot of individuals may not have access to primary care providers or specialists that are knowledgeable and affirming. And so that resource allows us to connect people outside of the NYU system to resources within the NYU system. Caveat being, Alex's role is generally, because it's coming out of the cancer center, is really for cancer-related activities, but I finagle that to be cancer prevention and screening. So we do navigate a lot of people to primary care providers. And I was just speaking with Alex, there's a growing number of primary care resources or providers that are accepting Medicaid. It's still not uniform, and it really is variable. But that's also speaking to why it's important to have such individuals who are knowledgeable of the system. And I see that a lot of what people have been saying, that it's been threaded through, of having the awareness of resources, knowing what is accessible, knowing what exists, and how to get that information out so that it becomes less cumbersome to try to know where to go beyond just the primary care. But if somebody does need more advanced care or specialized care, how does one then get to that next step and next level? And that's really what we were trying to do with the development of the care coordinator, is to help individuals who may already have primary care providers in the community, but not have access to more specialized care. How can they then have that continuation of affirming tailored care with providers that are queer identified or queer affirming themselves? So I think there's a lot of benefit to that, is having someone who can help direct, who can speak the lingo, who's part of the community, who can then help know where the resources are and connect people, and then also learn from the community of what needs are and how to make sure that we are trying to allocate resources in those respective spaces. So I'm not sure if that answers a question or if I just started mumbling, but thank you for that.
The director of the CUNY LGBTQIA+ consortium, one of my goals the last year, or maybe 2 years, is to link us up to the big medical systems like NYU, Mount Sinai, and Montefiore, and really kind of not bypass the campus wellness health centers, but supplement that as much as possible with the systems that are already in place, especially since those organizations like NYU are doing a ton of internal outreach towards the LGBTQ community and trying to really address the needs within the system. So it seemed like a natural fit to try to link that up with CUNY in some way. And I think that's where this conversation is coming from, is how do you do that? What is the actual way to do that? And what is actually in place where you can get that linked up and connected?
Allie, can you say a little bit more? So you direct the LGBTQI plus A+ consortium, and a few years ago this did not exist, and right now it thrives. Every campus has a chance to become part of the consortium. Every campus is now.
Every campus is now a part of the consortium.
Okay, 5 years ago, no.
Yeah. So if you haven't, followed it or been a part of it, the CUNY LGBTQIA+ consortium started out as the Queens Consortium. It was very small. It was a funding body that sent out funds to do LGBTQIA plus programming and education at basically York, Queens College, Queensborough Community College, and CUNY School of Law, small amounts. And then over the last 5 years, we really decided we wanted to like expand this out. And myself and my associate director, JC Carlson, worked quite a bit to bring in all 25 CUNY campuses into the consortium. And what we are is a funding body. We're not a prescribing body. So we recruit funds and then we send those out to the campuses to do LGBTQIA plus programming. We've provided funds to help build the LGBTQ centers over the last couple of years, everything from buying sofas for the center to like funding trainings to funding. Really, I'm always like, it's not my job to tell you what to do. It's my job just to give you some money and hopefully you can do this. And what I also try to do is look for connections where there aren't any. So like right now we have a film festival going on and we thought, wouldn't it be interesting if we had like an LGBTQIA plus film festival that ran across not just one campus, but like all 4 campuses, like multiple campuses, and they're all linked. So then we tried to like bring people together to do that. And one of the things that I've thought about, my own healthcare journey was not easy. And my husband's trans, he was denied like any gynecological service by multiple doctors after he started transitioning. And so I was sort of dismayed by CUNY's healthcare approach. So one of the things that's been on my mind for like at least 2 years, if not longer, was how to like actually like alleviate this problem. And so far, it's not something that I've been able to crack or figure. It's a big problem. And talking with both Matt and Elie and kind of like really trying to like figure out like what could we do led to this. And so all I can say is like we know kind of we're like this conversation is very valuable because it helps us kind of think about like, oh, we thought the problem was over here, maybe in terms of like getting more funding to services or something like that. And now it's like, it looks like the problem is like nobody even knows what those services are and they're grossly underfunded and like it's like almost like a vacuum. So now that shifts your whole idea of like how to tackle this problem where.
And yet I'm so inspired by the work that you've done to create the consortium because that did not exist. And right now, the conversation that we're having today, there's a lot of negative, we're not being negative, but there's just a lot of nothing there around LGBTQ healthcare on the campuses. But that used to be true around resource centers and LGBTQ programming across the campus. And now, you don't just get us a little bit of money. Every campus can really have extensive, thriving LGBTQ programming, including the Grad Center and CLAGS, and we're a huge beneficiary. But you had a vision for pulling this off, right? And so I just want to bring that in, that experience of creating something, not out of nothing, but out of very little, disparate, and working in a fairly short period of time. You have made the whole system, the face of LGBTQ has changed in the CUNY system because of you and JC.
Thank you very much for saying that. I appreciate that. But the reality is if I see a problem, I don't believe in just complaining about it. I really think if you see a problem, you need to like tackle it. Like that's the job, right? The job is not to complain about it until somebody else changes it. The job is for you to go change it. And so if you don't like politics, go get involved in politics. If you don't like how something's going, go try to create programs and funding for it. And I really that's my mode of working. And the way I tackle that is not to try to solve everything myself, but to find people that are smarter than me and as dedicated as I am, and then try to give them money or funding and try to have them do help them to do their work. And so I really think that's how we approach the consortium. There was no we want you to do this. It was what do you want to do? And then people like Chala, who was amazing at MedGrabbers, said, I want to do all this stuff. And we were like, okay, let's try to get Chala some money. And then we scrambled like crazy to try to provide it. But that's how I think like all of these problems sort of get solved is people, you have to go find the people that want to do the work and then try to empower them to do it. And if you found the right people, then it'll start to work. And I think right now what we're thinking about in terms of like this healthcare system is like, we sort of have identified the people within like NYU who are deeply caring about these issues and committed. So we've identified that. We haven't found the people within the CUNY campuses who are like, I want to like work to change the campus environment around health, right? So like how, like, which is like an on the ground sort of like thing of like, I've got to go find that person. I've got to figure out like why they don't have any funding. I've got to go find the deans who can help with that. I've got to go like, that's a bunch of like headache work, but that's how you sort of like manage this, is like really getting into the weeds and kind of rolling up your sleeves and finding out like what's going on. And this conversation is incredibly helpful for that, to be like, oh, that's what's going on in the Bronx. That's what like, that gives you some idea of a picture. And then the next level is actually going there and walking into those offices and being like, what are your problems? Like I'm assuming anybody working in a healthcare office like wants to be there and wants to like help. And if you go and sit there and talk to them, they're going to be like, these are like, I get paid this and I get this budget and it sucks and da da da. And then the job is not to be like, okay, well, this whole system sucks, I hate it. The job is to be like, okay, what can we do to figure this out? Can we get a grant for you? Can we get like can we go talk to like deans or CUNY Central to get this money to you? Like, how can we like get you help to do the job that you're doing well? So that's how I approach it. And I just found like, if you do that, then people are just like, you find all sorts of people that really are deeply committed. And I've had this conversation with Chala a million times where we'll be like, oh my God, it's so hard. It's just like, there's always a barrier. It's never going to work. And then I'm always like thinking, if it's easy, it's probably not needed, right? You can go work at a very like wealthy school with lots of resources and it'll be easy work. And you will not be making the difference you have here. If you come to like a public institution, you will be fighting tooth and nail for funding and for policies and for all sorts of things. But the reason it's hard is because it's necessary. And so that's my mantra, like going into like any system.
You can keep raising your hands. I'd love to hear from people who are representing healthcare centers on the campuses, if any are here. But Jason, you taught me a word. You said in one of our early meetings, thinking about putting today together and thinking we could do in the future, you said we need to identify our champions on every campus. And so one of the things that would help us today, some of the information that you could give to us is, who is the champion on your campus, or who would know, right? If you don't know the person, who should we go asking? Whose office should we walk in to say, in order to identify that person? Because they don't know we're here either, right? We're trying to start something. And we also know there's been work on different campuses, right? In the Bronx was a good example, but other healthcare centers have surely done surveys, and we know that they're putting on events like today, and it's hard to get around and figure out exactly what happened there in order to combine all that labor. But if one thing you could do today, and this is for people online too, you can put it in the chat, or you can email CLAGS at info@clags.org. Who are the champions on your campus? And Jason, while we wait for another hand, why is that so important?
Yeah, so it's very much towards what Allie was saying, is by knowing what's going on, it allows us to get a better understanding of what are the issues, what are the barriers, because some of them may be unique, some of them may be shared. A lot of times they're often shared, but it also helps keep a finger on the pulse, if you will. So say if we're able to pull all of this together and create resources that are then shared across the platform, what are the needs going to look like next year? If you have champions that are there on the ground, you can better understand, okay, this initiative worked great, but this one may not have worked well. We need more of this. We need more training. Towards your point is like, there may be a lot of people who are wanting to be in a healthcare center that are working there, but they may not know how to properly prescribe hormones. So that can be like, okay, now we can have education on how to prescribe hormones and what does that look like. There may be new guidelines that come up in terms of cancer screenings. By being able to connect with people who are champions in this space, you have that direct line of communication and you can keep that connectedness together and also identify if there's needs that arise at that same period in time. But it allows things like this to be disseminated a lot quicker, break down those siloing of components, and really be able to co-elevate each other. So if something's happening in the Bronx, it can be co-elevated by groups in Queens and vice versa. It allows people to communicate and share. So instead of working in multiple small groups, we can start working cohesively together to really elevate issues that they arise, but also elevate shared successes. So by knowing who those people are, those champions, and a lot of times they may be student champions, but as we know, that can be a lot. And oftentimes people as students will graduate and move on. And so having a faculty member or staff who can be there and continue to be there that can support and mentor students in the same space really allows this continuation of success and also gives a lot of leadership skills too. So there's so many different things that can be really spoken to about identification of champions. And sometimes it's about having people realize they are champions in these spaces. They may not feel like they're leaders. They may not feel like they have the skill set, but really being able to support those individuals to realize the value they have and really gain those skill sets towards the collective benefit. So just some, and there's multiple other reasons why, but that really helps break down a lot of the barriers that a lot of people we've been discussing about just the lack of sharing of resources. I think that can really be a useful tool.
I'd really like to highlight the 3 Bronx campuses because I know so much about them, but there are the CUNY Care staff. There is a single coordinator for each school, and that each person has such a huge workload, but they are one of the initial contacts for the students who are reaching out for resources, as well as each campus has a student navigator who is a peer navigator who has some training on resources and meet one-on-one, again, during business hours, so it's not accessible to everybody. But they can meet one-on-one virtually or in person with a student and just help them navigate the resources that they are aware that are available. And all of everybody that I've interacted with has really been a shining star in not getting paid enough, but doing a whole lot of work. And the student navigators are peers and they're interacting with folks when they're in crisis, and that cannot be easy. And so I really want to shout them out as superstars.
That's amazing. And that also serves like a great example of something that can be piloted to other campuses then, right? So really pulling the programs and initiatives that have been successful and trialed in other places, how can you kind of copy paste that onto other places, but also have that modification that may be adaptable towards specific needs that other people may have? But that sounds phenomenal work.
So used to projecting my voice that the idea of using a microphone threw me off. My name's Edwin Gonzalez. My pronouns are he and him. I am a student at Soberman and Hunter. I don't know that I specifically have solutions, but I think a lot of what you're saying about like replicating that model and what JD was saying about having connectors is kind of at the heart of things. I think from what I've seen as somebody who's visited CUNY schools before becoming a student and sort of being an outsider, it seems that there are some schools that seem to be like their own ecosystem. Like if it's like, we're talking about like Queensboro, because it's so removed. And then there are schools like the Graduate Center in Hunter that literally feel like you're in the subway station because people are moving through so quickly and they're just getting what they have to get done and they're not so invested. This is my feeling, maybe other people have different feelings. In community, they just kind of like are coming in and coming out. And I'm not saying that to be negative. I'm saying that this is what's there. How can we work with that? Because I think that there are people who are connectors and maybe they can get paid. Maybe there's some way to funnel some of those monies to them. Maybe they have a quota. right? Why shouldn't they be paid? If they're volunteering this time and they have a passion for it, that could be work experience that they can build on later. But I think students are the ones who know the resources. I think a lot of the students who are getting Medicaid are going to like Henry Street Settlement, community, like, Settlement Health, places like that, that might have like that one gay or affirming doctor who's aware of these things, and you would only know by word of mouth. Like, how can we create systems that are codified where people are sharing this information in a way that works with what's already there rather than trying to build something different?
I mean, I completely agree with you. I think the model we use with the consortium is find out what's already there and then just support it rather than try to rewrite it as it's something new. I'm a big fan of it. If it ain't broke, don't fix it.
Also, not to recreate the wheel. So a lot of people have, have done good things. So that can be, as JD said, pasted into other places. One question we've talked a lot about problems, but maybe if someone can share some good, we've talked about barriers. What about facilitators? Things that have kind of worked, things that are maybe success stories that we can, take home, not to my home, but to the consortium, and then try to see if we can recreate them, obviously with those little adjustments that are specific for each campus.
I kind of had a success story out at CSI that I'm aware of. A student was worried that he had contracted an STI and could not get the health care, but was already confident enough to be out and to ask for help. And so what a faculty member did was took him to a clinic in the city, went with him because CSI students don't come into Manhattan a lot, right? And there wasn't a place that the student wanted to do it on the island because they were afraid that they would run into somebody that they knew. And so the faculty member, because the student had been open enough to say, I need help, and the faculty member heard that, got the student connected to service. The kid was incredibly stressed, right? This is a huge worry. And as day after day goes on, the worry increases. And so this is a success story, not because it created a structure that's in place for the next student, right? But it does tell you about how valuable relationships are. And when we can talk about our health to each other because we've established good queer relationships, that itself is a kind of structure and can lead to success. And then, you never know how that can be replicated. Maybe the student then starts listening for other students who are saying, I'm a little scared, and then brings them along. I think those kinds of stories are also very hard to document, right? These anecdotal stories we don't see them because it doesn't look like something that gets left for the next person that's built. There's not an office or a job around that. We knew that when we created the survey, we were missing a ton of stuff, right? So we didn't ask this question of I don't think we asked the question about what went really well or what's going well at your campus, or tell us a story, tell us a narrative that you can fit into this project of just trying to find out what LGBTQ healthcare is at the campuses. But I think a lot about methods as part of my job. So I think finding the method that will allow us to get our hands around those stories would be great.
Thank you. This is Chala again. You made me think of a positive. Thank you. I used to be an academic advisor. This is my first year actually working with LGBTQI plus work in my job description, but I've been doing this as a champion, I hope, for 20 plus years. But as an academic advisor, I worked on small caseload model programs, which include SEEK and College Discovery, ASAP or ACE at the different CUNYs, as well as Macaulay. And what I always found striking about all three of those programs, or 4 or 5, those programs that have a caseload model, as an academic advisor with a limited caseload, I had a lot more time, even though we were always swamped. we had a different mission than the non-caseload model advisement. So we could build, students, data shows students are more successful if they feel like they belong at their campus. And if someone they believe someone cares about their success and knows their name. There's articles about this that say, if someone at your college knows your name, or the students will say, oh, I know so-and-so is expecting me to show up to their class, or so-and-so is waiting for me to meet with them, my advisor, is a lot of what is rooted in supporting financially these caseload model advisement programs, and they are successful at retention and graduation, right? We know these programs are successful. They're not campus-wide, though. They're for limited numbers of students. And I love reminding people that when I was an honors advisor, I was doing the same work as a SEEK counselor for different overlapping populations. Like, these are both populations that got a dedicated advisor that was coaching them and a champion for them. And some of the work I've done is helping, and my colleagues too, not just me, but my academic advisor colleagues, we're trying to uplift how to best support our students. And the more educated those folks are, they are referring students or going to appointments with students or walking them over to the health services. Academic advisors are doing that when they have the time. But you have to have that relational model with a limited caseload, 150 or less, as students to advisor, and those advisors will then hopefully have cultural competency to serve the very diverse students at CUNY, which they don't always. Because I was trying to think of a positive story, I kept coming back to two more negatives. Two more negatives of, I tried to put on a World AIDS Day event at a campus with consortium funds and was told by someone who was cisgendered and straight that that's their event. Like, I was trying to collaborate with them. Could I help grow this and make it co-sponsored? And a couple times, and maybe that would have changed if I worked with them longer, but the pushback I kept getting was, well, that's my event. I'm like, you own World AIDS Day? Like, what? Very strange. And then unfortunately at another campus, I was meeting with the person in mental health counseling, a therapist who was in charge of the trans support group. And as I'm meeting this person for like an hour to catch up, get to know each other, she keeps misgendering students she's talking about to me. And I'm correcting her 3 or 4 times in a 30 or 30 to 60-minute meeting. I literally, the 3rd or 4th time, I'm like, can we take a moment to pause and talk about why this is so hard for you? And I walked away from that meeting going, wow, this is the person who's super excited to stand up for trans and non-binary students, and she doesn't know how to use correct pronouns. This was a while ago, but it was still not that long ago. And I think of those folks. So anyway, back to the positive for me is that relational piece. I'm so excited to be here because there's a few folks I want to talk to, being in this space now going, oh, this is an opportunity to build those coalitions and those relationships and connections to champions.
I have a positive, and I think the consortium helped to pay for it. The Pride prom last year was really, really fun. And I wasn't expecting much because it's CUNY. So I was like, I didn't plan anything. Like, I was just with my friend. And I was so surprised, and it was so much fun. And it felt like a real, like, it felt like there was intention put into it. And that made me feel, as a queer CUNY student, like, oh, cool, they like me. And that was, I mean, and here I am now. So that was like a cool thing. I hope that happens again.
Thank you for sharing that. That's wonderful.
Is there anyone here from a health center? So that's a conversation that we hoped to have today. And so I know that this group is going to pursue that conversation as we wrap up. That's a question we'll ask. We also just need to know, what else are we missing? And so one way you can tell us that is to take the survey that we gave you and just use it as to write something on it for us. Here's a champion at a campus that I know. Here's something you missed that we didn't get to talk about today. I know that on my campus there is no mental health care, or there's no medical care. all of that information is very, very useful to us because sometimes Merlin, by the way, thank you for putting together this incredible document that has all of the healthcare centers, where you could find them and the contacts and reaching out to them. But a lot of emails go unanswered because we just all get a lot of emails. And so we actually don't have some information that seems like it wouldn't be that hard to get. And so any information you can give us, any criticism about, well, why didn't you think about this? That's very helpful. We're at that stage. If you look through the survey and you think, oh, wow, this was a really smart question, or a really dumb question, or I don't understand this question, we're going to send out the survey again. We didn't get as many responses as we would have liked. And so we need help in editing and redrafting this. If you can do it on the fly today, that's great. But also you could take it home with you and then send it back our way, scan it, send it to info@clags.org, or my email is matt.brim@csi.cuny.edu. Just find a way to get information back to us. We'd really appreciate it.
I thought I saw a hand up back there. Allie's very quick.
I was just going to say that I feel that at Silberman that the students have used WhatsApp as a really great resource to share all sorts of information and resources about how to help each other and how to help clients. And it's really robust, and it's been a great tool.
I have a few questions about this survey. The first is, what student population will get it? How will they get, or how will they be responding? Like, is this going to be a Google survey, or because that's going to change how, if they're clicking through things like pages, or if it's just one big thing. And then ultimately, what is y'all's number one goal? If you could put it in one sentence that is like 2 lines, your goal from the information that you want to know from this survey.
Marlon, maybe you can answer the survey question. How did we administer the survey?
The survey was administered through Qualtrics, which is just like something similar to like Google. If anyone's used it, something similar to like Google survey, but they have like a little bit more. There's a little bit more. I guess like I wouldn't say infrastructure, but they do more with data management afterwards. Within the actual database, like in Qualtrics. And you can also make different sections, and it's similar to Google surveys in that way as well. And then it was just emailed to most students, which I wasn't a part of that part.
So the delivery method was through the consortium out to the LGBTQIA plus representatives at each consortium. It was a limited amount of time that they had to actually get it out to the students and back. So subsequent efforts will give a much longer response time allowed. And then just in answer to the question of like 1 sentence, 2 sentence, the goal of this is to lay the groundwork for improving CUNY-wide LGBTQIA+ access to health. So there's lots of stuff going on in the Bronx. There's stuff going on in Brooklyn. We wanted to kind of like get a picture of what's going on across CUNY, and then see if we can do something similar to the consortium where there can be like a linkage to the resources that we already have with different medical organizations to CUNY, and not an unfocused way, but in a focused, networked way. Sure. Yes. What that resource is, whether it's purely informational, or whether it's actual connections to organizations like NYU that can actually like network into each health center, that we need to like we want to know first what's there and what's working, and then sort of think about how to like try to build this across campuses.
And what I wanted to say is also not just build the resources, just to create interventions. A resource is it's a type of intervention that can help mitigate those gaps that we know that they exist, but we don't really know what they are specifically and how much is it implicating, right? Speaking from public health, it's population at risk. Is this a problem affecting 2 people, or is this a problem affecting 250,000 like students of CUNY? So that's trying to see, again, it's a part of limited resources. So trying to allocate it, and I mean, just talking on your behalf, and trying to allocate it to the most at need and the most critical. Sometimes it is a very critical issue that is affecting a smaller number, or it's a not too critical affecting more. That's what we're trying to get. So a resource is one type of intervention, creating spaces, connections, alliances, events. You mentioned one word, that the intention is there. The means is sometimes we're oblivious of it.
Thank you. Hi, I'm Kate. My pronouns are they, them. And I'm a student here at the Graduate Center, part of the Quantitative Methods master's program. One thing that kind of a theme that I think piggies off of a few different points that folks have made regarding the Graduate Center specifically. So I think, actually an example of someone who had historically treated the Graduate Center kind of like a subway stop. Come in, go to class, leave, go home. I'm enrolled part-time. I work a 9-to-5 job, come here in the evenings. So a lot of my sources of information generally for anything that happens across CUNY, either in the Graduate Center or at other campuses, is either I got the whim to look stuff up, which is how I was introduced to you, or actually getting information passed down directly from my program advisor. I would say 90% of any information I get on resources that are available and events or programming that's happening is almost exclusively through the head of the QMSS program, Jeremy Porter. So I don't know how applicable this would be kind of outside of the Graduate Center, but I would assume that at least here, there's probably a good share of folks who probably treat this campus similarly. So other points of or contacts that might be worth trying to get involved are program heads and department heads. I know Professor Porter especially is forwarding us stuff basically daily on, hey, update from the library, hey, update from this student group that wants to go give a presentation in one of your classes to introduce you to different things that are happening. So just another potential path to consider.
Yeah, who do students listen to? Which emails do they open, right? Who has students' ears? Figuring that out on each campus.
Chala speaking. Wondering where there might be a connection. I don't know if anyone has access to this data. There was a student sort of campus climate survey CUNY-wide not too long ago. I don't know if it was a year or more, but I'm so curious. Maybe it was within this year actually, because I was asked to get more LGBTQI plus identified students to complete it. And I don't have any idea what happened with that survey. Anecdotally, I've been like, anyone know what's going on? And people around me are like, oh, we don't know what's going on with that survey. But I'm so curious what data might have been put into those responses from across CUNY, students asking what their experience has been like as a CUNY student. So that's something I'm curious about. And then just generally, is there any update, maybe I missed it or not, on like for services from places like NYU, Langone, is there any updates? Because people ask me about preemptive compliance and accessing gender affirming care for youth that you can speak to.
Jason.
Yeah. So as of now, per my knowledge, the offering of gender affirming care for individuals under the age of 19 is on hold. Everything else is accessible over the age of 19. If anyone has, per my knowledge as well, if anyone has been initiated on treatments under the age of 19, they will be, even if they're from the NYU system or they're transferring care into the NYU system, if they have been started, NYU will continue. What they are not doing is initiating any new treatments for individuals under the age of 19. We do have an LGBT council at part of NYU who's been verbal about opposition to this. A lot of the concern, though, is withholding of federal funding if we are not in non-compliance. And so that's kind of the situation we're at. Not happy about it, but we've been navigating people to Cal and Lord, who's continuing to provide care, and trying to utilize the resources we have to navigate people to those facilities and providers who are still maintaining care. That's currently where we're at, trying to still push within the system as best as we can.
And I do want to add that though the system is a little bit rusty or getting rusty, the people are still there. So all of us are still there. We are still providing, I mean, at least I can talk about myself. I am still providing gastroenterological care for all of my patients that is, grounded on their identities, their sexual orientation, their gender identities, and on everything. So the people are still there.
Yeah.
Maybe a little bit undercover, but we're there.
Yeah, and it really speaks, in my mind, it really speaks to the importance of these collaborations, right? So we know that one institution or one center is unlikely to provide all care and resources and be able to encompass everything. However, if we work collectively, that's where we can best identify gaps, best help navigate and share, best learn from what is working, what isn't working, and how we can really move the needle forward, especially in times like these where we do face unprecedented barriers. How do we continue to be resilient in this? And it's one of the things I've learned is the red tape or the violet tape or whatever color NYU's tape color is. How do you know how things work? And then how do we navigate within that? And that's another example of why champions are really so important, is because they have that really fundamental knowledge or insider scoop on how the political system works at that specific campus or institution. And then they also know how to get around it in certain ways. And that is a really good way of being defiant in certain strategies while being compliant. And so that is something that we can do. And that's how we really form our community in being visible and at the same time knowing how to be resilient. And so, as Elie said, there's still a lot of really great people there. And why this is so important is how do we continue to provide those care and resources and access for people, regardless of background, identities, gender identity, sexual orientation, whomever one is. It's important that people have tailored, affirming care. And so that's our mission, or to continue that.
As we wrap up today, I just want to say on behalf of CLAGS, but I know I speak for the consortium and for Elie and Jason as well. We want to thank trans people for being visible when you can and where you can. I'm not trans, but I want to thank trans people for being in my life as part of CLAGS and part of CUNY. It's been an incredibly important part of my job and my education here. And so just to zoom out a little bit and back to the day, Transgender Day of Visibility, you all were already champions, transgender people who are visible and helpful and teachers and put up with those of us who don't always get the pronouns right and try. And so you make it, on behalf of everybody who's an ally, you make our lives better and you make my work personally at CLAGS better, and I appreciate it. So thank you for all you do and for being you, and thanks everybody for showing up today, for bringing your knowledge and your questions. Thanks to our ASL interpreters. We appreciate it. Merlin, it's good to see you. JD, it's good to see you. Allie, Elie, thanks so much. On behalf of CLAGS, thanks everybody. If you need more information about us, you can go to clags.org. And if you have any kind of follow-up information, you can send it to the emails that Hannah put on the screen. Thanks so much for being on the back end, Hannah. Thanks everybody.